Good morning, students. Now today we are going to see the extensor compartment of the forearm. This is the extensor compartment of the forearm. Here the muscles are divided into two layers, superficial and deep. First, let us go to the superficial muscles. Now the first muscle in the superficial muscles is the anconeus. Now here you can see the small triangular shaped muscle. This is the anconeus muscle. This is the lateral epicondyle of the humerus. The anconeus, it arises from the lateral epicondyle of the humerus and it is inserted into the posterior surface of olecranon process of ulna. This is the anconeus muscle. It is supplied by radial nerve and the branch to the anconeus is given in the radial groove or the spiral groove. The next muscle in the superficial muscles, the next muscle is the brachioradialis muscle. This is the brachioradialis muscle. The brachioradialis muscle, it arises from upper 2/3 of the lateral supracondylar ridge of the humerus and it is inserted at the base of the styloid process of the radius. So this is the brachioradialis muscle. Deep to the brachioradialis. Second is the extensor carpi radialis longus. This muscle is the extensor carpi radialis longus. It arises from lower 1/3 of the lateral supracondylar ridge of the humerus and as you can see over here, the tendon, it gets inserted at the base of the second metacarpal. The third muscle, which lies deep to the extensor carpi radialis longus, this is the extensor carpi radialis brevis. Extensor carpi radialis brevis, it arises from the common extensor origin, that is the lateral epicondyle of the humerus, and if we trace the tendon, here we can see that it is getting inserted at the base of the third metacarpal. Now, these tendons of brachioradialis, extensor carpi radialis longus and extensor carpi radialis brevis are crossed by tendons of the deep muscle. This is the abductor pollicis longus, this is the extensor pollicis brevis and this is extensor pollicis longus. These three belong to the deep layer of the muscles, but these tendons, they cross the superficial group of muscles. The next muscle in the superficial layer is the extensor digitorum. Now this muscle is the extensor digitorum. Again, the extensor digitorum, it arises from the common extensor origin, that is the lateral epicondyle. Here you can see the extensor digitorum, it divides into 4 tendons for the medial 4 fingers. These tendons of extensor digitorum, they pass and they get inserted at the base of the middle phalanx. Next is the extensor digiti minimi. This is the extensor digiti minimi. It also arises from the common extensor origin and the tendon, it gets inserted, it joins with the tendon of the extensor digitorum. Here you can see that the tendon of extensor digiti minimi is joining with the tendon of the extensor digitorum and getting inserted. Next is the extensor carpi ulnaris. Now this muscle is the extensor carpi ulnaris. Again, taking its origin from the common extensor origin, that is lateral epicondyle, and it is getting inserted at the base of the 5th metacarpal. Now, these are the superficial. Now let us move to the deep layer of the muscles. The first muscle in the deep layer of the muscles, this is the supinator muscle. The supinator muscle, it takes its origin from the supinator crest of the ulna, from the lateral epicondyle, also from the lateral ligament of the elbow joint, annular ligament of superior radioulnar joint, and it is inserted into the neck and anterior surface of upper 1/3 of the shaft of radius. So you can see it winding round It is adhering to the upper 1/3 of the shaft of the radius. So this is the supinator muscle. The supinator muscle is supplied by posterior interosseous nerve. Next is the abductor pollicis longus. This muscle is the abductor pollicis longus. The abductor pollicis longus, it takes its origin from the posterior surface of the radius as well as the ulna and the intervening interosseous membrane, and it is getting inserted at the base of the proximal phalanx of the thumb. This is the abductor pollicis longus. Next is the extensor pollicis brevis. This is the tendon of the extensor pollicis brevis. You can see that it is taking its origin from the posterior surface of the shaft of radius, also from the interosseous membrane, and again getting inserted into the thumb. The third tendon is the extensor pollicis longus. Extensor pollicis longus takes its origin from the posterior surface of shaft of ulna and adjoining interosseous membrane and getting inserted at the base of the distal phalanx of the thumb. The next deep muscle is the extensor indicis. Now this is the extensor indicis, which again takes its origin from the posterior surface of the shaft of ulna along with the adjoining part of the interosseous membrane. Here you can see that the tendon of the extensor indicis is joining with the tendon of the extensor digitorum and getting inserted into the extensor expansion. Now, emerging between the strata of the supinator muscle, here you can see that this is the posterior interosseous nerve, which is a deep branch of the radial nerve. The posterior interosseous nerve, it supplies the extensor carpi radialis brevis, supinator muscle, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, extensor indicis, extensor carpi ulnaris, and the extensor digitorum. Here you can see this is the posterior interosseous nerve, that is a deep branch of the radial nerve.